This is Dr. Corey Maas on Looking Your Best, talking a little bit about the enhancements, the peripheral things that we can do to really make our improvements around the face, neck, and chest area, in particular with the skin, using skin care, the different surgical options we've talked about, improvements in the chest and neck area using laser skin resurfacing, fractional laser skin resurfacing, broadband light therapy, or sometimes called IPL, to improve the color of the skin. And when we look at these areas of sun exposure, the other one that stands out is, of course, the hands. The hands are, along with the neck and chest, are the areas where we get the most sun exposure in the Western world. And those areas are the areas that are the subject to the most damage from external or environmental exposure, the sun being the worst of them. What we see typically in the hands is thinning or atrophy of the musculature in the inner tendinous area. If you sort of stretch your hand out and see a big dip, those big dips represent loss of volume, some muscle atrophy and some fat atrophy. We'll often see wrinkles and fine lines across the hand, both at rest and when extending or fully or even flexing the hand. And then the changes in color, which are representative of both sun damage and some genetic changes, which are most commonly seborrheic pigmented, seborrheic keratoses, a big word, but basically benign waxy lesions of the skin, which affect our hands and arms disproportionately, along with our face and hairline. Those areas, and they used to call those liver spots, by the way, really represent just a genetic predisposition for the formation of seborrheic keratoses as benign growths, which should be evaluated, by the way, anytime there's sudden change in any kind of pigmented skin lesion. That should be evaluated by a doctor. But the other things are these big confluent, or stuck together, if you will, macules or freckles, which are, for lack of the description commonly in the medical literature, as senile lentigines. Now, I didn't make the name up, but it's obviously going along with getting older, and lentigines are basically big freckles for all practical purposes. So as we get older, we have a tendency to get bigger freckles, along with sebcares, along with atrophy and wrinkles of the hands. So there are a number of treatment options to improve hand beauty, to make them match your face. When we're treating the face, we want to make sure the hands match. And when those hands are matching, there's a nice even distribution of color. We've minimized the fine lines and wrinkles, and we've made sure that the volume of the hand is appropriate and corrected. We don't like to see lots of veins. And along with that, so along with those improvements that we'd like to see, we're matching the appearance with our overall aesthetic. The options for improving the skin quality include doing some type of resurfacing, fractional laser. Improving the skin surface can be achieved doing broadband light and treating those pigmented lesions like the senile lentigines or big macules, freckles that we talked about. In some cases, ablation, if you have seborrheic keratoses, that can be done by light scraping or curettage, laser. There's a number of ways of destroying them, but we want to do it in a way that doesn't cause lighter areas of skin or hypopigmentation, a common side effect from overuse of any destructive method, including the freezing technique very commonly employed by many of our colleagues. And there's nothing wrong as long as it's not over-treated, because we want to trade off a dark spot for a white spot. I think that's the important concept. And that can be done by minimizing the depth of injury. So fractional laser is an excellent way of doing this. We do it sequentially, and we'll commonly do it with other areas of a treatment. It's about still 5 to 7 days of keeping an ointment on the hand. It improves the fine lines and wrinkles as well as the brown spots on the skin. We'll often combine that later with broadband light therapy, which is the crystal applied to the skin surface, or just do broadband light therapy alone, which has no downtime or healing time. The macules or freckles, lentigines, just get a little darker, and then those dark spots look like coffee grounds over a week to 2, and they naturally exfoliate. There's no wound healing involved or no real downtime. If you stretch your hands and see a dip there, that's an area for augmentation. We have a number of different fillers that can be used, a number of excellent publications. The area in between the tendon, when a filler is applied in that area, softens the depth of that and thus improves the youthful look of the hand. Some of the water retaining capacity of the HA fillers also helps to attenuate or soften the wrinkles in that area when it's done. And there are very few side effects when the hands are done correctly. Bruising is one that's not uncommon, but can be covered with makeup. And it also disguises then not just the depressions, but also the veins in these areas. So there are a number of excellent approaches to hand rejuvenation and maintenance. And those include, again, the treatment of the skin, the treatment of the volume, the skin in terms of texture and wrinkles, the treatment of the volume and restoring the lost volume, and of course treatment of the color, the discolorations or dyschromias that we described that affect the aging appearance of the hands. If you have any questions about hand aging or their treatment, please don't hesitate to call or write, send photographs or videos. And as always, I'm happy to answer those privately or publicly if you wish to share them so that others can learn too. This is Dr. Corey Maas on Looking Your Best.